Hello, hello. Dr. Kristen Stuppy here. I am trying something new today. We're going to see if I can get Zoom to work through Facebook so I can do Facebook Live and use some slides and fun things. Not sure if this is actually working or not because I am trying something new. But looks like I need to actually start it maybe. Nope, I'm here. I'm going. All right. Sorry for this confusion. I am learning something new, and unfortunately, I don't know how to preview this without actually going live. So we're going live through Zoom today because it is easier for me to talk on things if I have some prompts. Because like many people, when I'm just talking for 15, 20, 30 minutes, however long I talk, it is hard to remember what I'm going to say. So anyway, I am Kristen Stuppy. I am talking today again about coronavirus because that's the question that's on everyone's mind. Today is August 21st, and things change with coronavirus. As we know, back in March, we were originally told lots of things that ended up changing. And so anything today that we hear could potentially change. But I want to talk a lot about just general things. I am talking with my mask today to show you that it's okay to talk with masks. I talk to people all day, every day now in my office, not only with the mask, but usually with a face shield. And with the face shield, I have to talk louder, and so it reverbs in my ears, and that's just going to confuse me here. In the office setting, though, the face shield helps protect me. Goggles also work. So healthcare providers are oftentimes now wearing some sort of eye protection while we are in the office. And that is because when we are in the office setting, we are exposed to lots of people. The eye protection actually protects us if someone breathes in our face, coughs in our face. We do in my office ask people to wear masks. And so I am protected while I am talking to them. But when I examine them, I usually have to have them take off their mask so I can look in their throat, in their mouth. And at that point, I am not protected from them. So we always have to remember that our masks protect other people. I wear my mask when I am outside, when I am at the grocery store, when I am at my office. We wear masks, encourage our staff to wear a cloth mask or a medical grade mask from their car to our office building. And then when we're here, we change into a medical grade mask. And then we wear it all day, except for when we're eating. In our office space, we have changes to how we eat. We used to all cram into the break room and eat, but now we have X's marked out on different spots of the tables where people eat so that they can stay separate from other people, because we know that one of the biggest risks in any workplace is fellow coworkers, because we're familiar with them, we're used to them, we don't see them as a threat. We see that other person at the grocery store is a threat, and that other person at the grocery store is probably less of a threat because we see them briefly and we walk past them, or we stay 6 feet back from them. But our friends and coworkers, family members, we are up close and personal. We are less likely to mask up. We are less likely to maintain that distance. So we know in our office that our coworkers are one of our bigger risks. So we try to mitigate that risk by seating changes that we encourage at the nurses station. We've kind of spaced them out a little bit. They wear masks when they're seeing patients and when they are talking on the phone now and when they are doing things. But we try to mitigate risks as much as possible, and we encourage you guys to do the same. And that includes when you are going to hang out with friends, try to sit in the backyard, spaced out, wear masks whenever you can. If you're eating, you need to obviously take off masks, but then do the distance thing, because until our communities stop the spread of this, it is going to continue to be a problem and a concern for everyone. And I know that a lot of people are not so worried. They say the large majority of people are fine. It's not even as bad as the flu in some cases, which could be true. We do think that most people, probably 80% of people, don't get very sick from this, but we don't know which ones will get sick, and we still don't know long-term complications. If I were to catch measles today, then years from now, months from now, sometime from now, after presuming to have been um, completely healed from measles, I can develop something called SSPE. That is universally fatal. We don't see that much because we don't see much measles, but that is a complication that we know of from that particular virus. More commonly, people have heard of shingles because most people in my age group and older have had chickenpox as children, and we are at risk of getting shingles as adults. Most kids now are protected from that because we have the vaccine. With coronavirus, we don't have a vaccine. We don't know what the long-term complications might be. The large majority of viruses don't have long-term complications, so there might not be any. And I don't want to cause mass hysteria by saying that we don't know what they could be, because we don't know if there will be. But if there are, we don't know what they will be. And this virus, I just don't want to underestimate. It causes weird things. It can damage lungs, kidneys, liver, brain, all of our body systems it can affect. So I don't want to underestimate this virus, and I want us all to be safe. So with that being said, masks help me not spread to other people, and other people I rely on to wear masks so that they don't spread to me. So anyway, I wanted to try this new Zoom through, or Facebook Live through Zoom, so that I can have a little help with my presentation. So I am going to pull up slides because it just makes it easier for me. So basically, just going to talk about more pandemic things. And just this morning, one of the pediatric partners, families that see us and follow our Facebook, sent me this meme as a comment or a message. And I just thought it was hilarious because here we are all up in arms about getting kids back to school. And I know that's a big thing. But we have to think about the things that the schools haven't necessarily told us to think about. And one of them is that mask on the floor there, or your kid, you know, there's also the meme where I sent my kid to school with a Spider-Man mask and he came home with a Paw Patrol mask. We're going to have to think about that and make sure our kids know that their masks are not to be shared, and that they have a place to put them when they remove them for their mask breaks, if they're allowed to have mask breaks, or if they're eating. And I posted earlier this week on our social media about lanyards. Lanyards, just like little old ladies in their glasses that they, you know, their reading glasses, they hang down. You can get mask lanyards. I am really a fan of ones that have breakaways, because the breakaway, if somebody pulls from behind, I don't want them to get choked, or if somebody grabs the mask from the front, I don't want them to have issues. So the lanyards with breakaways are really good. And there are some that actually double as ear savers. If you've ever seen my post about ear savers, where buttons on hats or ribbons or elastic bands or what do I want to say, like a headband or something, buttons, you can put the mask, not the ties like I have on today, but the masks that have the ear loops. Instead of pushing the ear loops down, you can attach the mask to the buttons, and that preserves the ears. They have lanyards that kind of double as that too. So double the function. Your kids can have something that their ears are protected, and then when they need to take the mask off, it just hangs in front of their body, so it's not touching other surfaces. So those are little things to talk about with your kids of how to take care of masks. One of the big questions that I'm getting in the office now, though, is about testing. Everybody seems to want to test because lots of people in our community now know someone who has been tested positive. I think there's a lot of misunderstanding about the tests. We all are familiar like with strep tests. Most of us have heard of someone who had a negative strep test in the office, but then the backup test is positive. Sometimes we will still have a condition, whether it's strep or COVID, even if a test is negative. So we have to be very careful with the COVID testing because we know that this is a tricky virus. we can have no symptoms for quite a long time before developing symptoms, or some people don't seem to ever develop symptoms. We don't think that that is completely innocent. We know with kids, for instance, a lot of kids that are getting this MISC-C, multi-system inflammatory um, symptoms in children, where they can have problems with their heart, their lungs, their kidneys, their skin. It usually develops after they've cleared the contagious part of COVID. So a lot of those kids who are super sick and admitted to the ICU actually don't have positive COVID testing at the time for acute infection. Their infection was in the past. So that's one of the reasons that I really think we cannot underestimate this virus. We don't know exactly how it's going to present or when it's going to present. So just basics with the testing. I am a big believer that the testing is super important for the community. We can help guide our risks based on if we know that the tests or the coronavirus is in our communities. It is not very helpful on an individual level. If I have a test today that says negative, it could be that it was negative because I really don't have the infection. It could be because it was negative because I tested too early. It could be that it was negative because the test was not accurate. There are stories of, the nasal pharyngeal swabs that are supposed to go in the nose all the way to the back of the throat are just done in the front of the nose. That's not a good sample. If you don't have a good sample, you're not going to get a good result. So there's lots of reasons for negative testing. There's ideal windows that seem to happen with symptoms or exposure that testing is more likely to be reliable, but not 100%. So the guidelines that help people get back to their job, back to their sport, back to school, don't include testing. We have gotten lots of requests from our patients asking for a test to clear them to go back to work or back to sport. And that's not how it's done. You do not need a negative test to go back to whatever you need to go back to. If you are exposed and have no symptoms at all, you should stay home for 14 days from the last exposure. Now, if you were with this person that has COVID for 3 days in a row, it's not the first day you were exposed to them, it's that last moment you were exposed to them. So from the last minute of exposure for 14 days, you should stay isolated away from other people so you don't spread if you have it. It does not matter if you have a negative test, but it matters if you were exposed. If you have a positive test, then at that point in time you're positive. Then the test helps the community because then you can backtrack and find all of your contacts to then have them stay home and isolate. So it helps from a community standpoint. It helps us stop the spread if we know that someone is positive, but it doesn't have the reverse effect. It doesn't change you not having to stay home. You still have to stay home if you know you were exposed. Masks do not change that either. A lot of people say, well, what if we were wearing masks? And in a hospital setting with people who have been trained how to properly wear a mask and a surgical type mask that has been shown to be a little bit more effective than the cloth masks, that is looked at differently, again, because we wear things like the goggles or the face shields for protection and have the surgical mask or the N95 mask, depending on what our risks are perceived to be at the time. But the community setting masks don't count towards exposure. The exposures are considered to be if you were within 6 feet of someone for 15 minutes or more, especially indoors, but even outdoors, you can still be exposed. I have had several of these calls requesting testing from families who were involved in a sport with their child, and either someone on the team or a parent of someone on the team was at practice or a game, and they are considered an exposed person based on the public health tracking and tracing. So if you are going out and about, please wear your masks, because if the person who is exposed and contagious is wearing a mask, it is much less likely to spread. It does not negate the fact that you potentially could have exposed people. But it definitely helps. And then the contacts from that exposure, if you were wearing a mask and they were wearing a mask, it's a lot less of a risk. Um, we have to rely on our public health tracers to identify the true risks versus the not true risks, because a lot of people who haven't been contacted by the contact tracers just heard from a friend that they're at risk. Everybody wants testing, and right now our testing capacity is limited in most areas. I am very much hopeful that testing will become more widely available. I am super excited that the saliva testing was approved last week. Um, the saliva testing is interesting. From what I understand, it is still a PCR test. So that the PCR tests basically take the genetic material from your nose or the saliva and amplify it so that it can find small amounts of it. And it is considered the gold standard when it is the nasopharyngeal PCR testing. The saliva testing is not as accurate. We know that we can miss some of the people who are actually infected, but the benefits to it is it's less expensive, it uses less reagents, and it doesn't require specific test materials as much as the other tests do. So it can be done more widespread, a lot less money, and so it can be done more often. So if you could do testing on a regular basis with people getting tested a couple times a week or every day, even depending on what the risks in that community are, then you can identify people, even if it's less accurate and they aren't identified the first day they would have been contagious, but maybe the second or third day because of that repeated testing, you can have more security knowing who in the community is at risk. If they test positive with this saliva testing, then go back and contact trace with the more specific tests. I think we can get things under control much better, and I'm hopeful that that will take hold and communities will start using that. It is not available currently, as far as I know, in our community, but I'm very hopeful that that will be done. Colleges, that could be a very helpful thing because you have those closed communities. Schools, again, closed communities, even workplaces, big businesses, that could be very helpful. But right now we are relying on mostly the nose swabs of some sort. In our office, we are able to swab, and then we send it to a community lab for results. And our results are coming back still fairly quickly. Some people, depending on the age of our patient and the reason they're being tested, we can send them to some of the local hospitals or testing centers. And a lot of that just depends on current availability, current turnaround times, and that changes by the day. So I cannot tell you what we would do specifically with any individual person that's calling. But a lot of times parents are upset because we tell them, no, we don't recommend testing. And the main reason we don't recommend testing is the chances of getting a false negative result are pretty high if there was just an exposure and it was recent. You need to wait at least 5 days before an asymptomatic person is going to have more reliable test results. And then the negative test still doesn't mean anything. And one of my big fears is people see that they're negative and then they feel like they're okay to go back to practice, back to work, back to whatever. And that's not the case. The CDC says that you still need to stay home for that 14 days if you're asymptomatic. And if you're symptomatic and you have a positive test, then you need to stay home for at least 10 days from the start of symptoms and 24 hours fever-free without medication and symptoms resolving. So if someone's sick enough to be hospitalized, they're not going to meet those criteria to not be contagious anymore. But if someone is home, feeling better, getting no fever without any fever reducers, and it's been at least 10 days since their symptoms started, those people are not considered contagious anymore. And that's because studies have shown that people do not seem to spread disease when they meet those criteria. So the testing does not have to be done to get you back into the community. And part of the reason for that is some people have been shown to have positive nose swabs for months. And that doesn't mean they're contagious. It means that they still have the genetic material of the virus in their nose, and we can find it on a test, but they are completely resolved with any of their symptoms and they are not able to spread the disease anymore. So the testing is really good for the community. So we know what levels are and we can contact trace and we can identify people and keep them home. but we need the community to be responsible to actually stay home for as long as they're supposed to stay home. And masks work. I've said again and again and again, we need to wear masks. Everyone needs to wear a mask. Basically, when you leave your house, you should have a mask. If you are outside and you're able to stay at least 6 feet away from people, ideally more, especially if you're exercising. Some studies are supporting 10 to 12 feet if you're exercising, because you're breathing deeper and that deeper breath expels air further out. But covering your nose and mouth, no touching your mask up and down. If your mask slides, you need to fix it. If the ear loops are too big, you can tie the ear loops. If that doesn't work, you can also get those buttons on a bandana or a headband or a hat or a ribbon or an elastic band. Buttons are easy to sew on. You can get your kids even to help sew buttons. It's a good skill to learn. I have been a big proponent of getting these ear savers because it also protects the ears from having too tight. I see kids come in all the time with their masks like this because the ear pieces are so tight. Or you can get those lanyards now that have the ear clip things here so that you can have the ear saver doubling as a place to put your mask when you remove it for eating. When you do remove your mask for eating, you need to have that 6 feet minimum separation. I know a lot of schools are thinking about how they're going to eat outside or do other things to increase the space between students so they're not packed into lunchrooms. Do the same thing if you're eating with your friends. Avoid enclosed spaces close together. So eating at a friend's house in their dining area in the house is not a good idea. If you meet with friends and eat on their deck and sit far apart and then put your mask back on when you're not actively eating, that can help. As far as the masks, practice with your kids. If you haven't yet already, wearing a mask all day is hard for a lot of people. Once you get used to it, I wear my mask all the time and I'm so used to it now. Sometimes I forget it's on. But have your kids practice with sanitizer of some sort to wash their hands before they remove their mask and before they put it on. Have them use the earpieces as much as possible. If your hands were just sanitized, you can pinch the nose if you have a nose piece to help pinch. If your hands aren't clean, try not to touch the front of the mask. I saw a really great video that actually is scheduled to share on our Facebook page tomorrow morning, I believe. The Child Repair Guide is a blog website from Dr. Steve Silvestro, and he had a great video, great idea. All kids know the volcano game where they don't hop on certain colors if they're on a tiled floor, or they don't hop on certain things because it's a volcano and the lava, I guess not a volcano, but the lava, don't want to step on the hot lava. They all know that game. It's fun, and it's a way that we can use to keep them from touching the front of their mask. Just say the front of their mask is lava. They can't touch the front of the mask. They can't touch the lava. That is a fun way to help remind kids when they are pulling it up, messing with it. Don't touch it, it's lava. And they'll all think it's fun and do that. So I love that idea. If Dr. Silvestro ever hears this, thank you for that wonderful idea. One of the things that has become really popular is the masks with the little valve. They are much more comfortable because the humid air that we're breathing and talking comes out. So they're a lot more comfortable and people like them, but they don't do what they're supposed to do. My mask is supposed to keep all of my germs to me. So if there's a valve that lets things out, it's not doing its job. So a lot of areas of the country have, if they have mask ordinances, some of them are specifying no valves. If there is a mask with a valve that you really like because it's comfortable and it fits you well, you should wear another mask on top of that so that the second mask helps collect whatever's coming out of the valve. And that can help make it more safe. But the big thing is wearing a mask. The material matters and the fit matters, because if it's huge on your face, it's got gapes on the sides, or it slides down, or if it goes up into the eyes, if it's not fitted right, then you're going to mess with it more. So try not to touch, and encourage kids not to touch, but it's hard to do that if it's not fitted. So make sure it fits well. And then the material matters. A lot of people are worried about gaiters now because the study that came out showing that fleece gaiters did not only not help protect, but actually cause more problems. It was probably more of an issue with the fleece material that the gaiter was made out of, not necessarily the gaiter style. If gaiters are made out of the material that the other cloth masks are made out of, I've heard like the woven cloth, like quilters use, is the best material and at least double layer. Some people will put a filter in it that increases the benefit. But basically, you want a mask that helps keep your air that you're breathing with all of the particles of humidified air, the liquid particles that carry the virus, keep that on the inside layer of the mask. And then other things that you are inhaling as you talk, air goes through just fine, but you want to keep the particles on the outside. So teach the kids that I've always said it's a germ catcher and you don't want to touch the germs, but I do like the lava idea as well. And then you guys practice. And then the 3 W's are wearing the mask, washing your hands, and watch your distance. And that distance is at least 6 feet. I am the parent of 2 college students, and I am a pediatrician for lots of students. I am seeing a lot of mental health concerns and issues with all kinds of teens, tweens, and kids. There are some who seem to be doing great. Kids who have a little social anxiety anyway, who don't like going to school because they don't like talking in front of people. They don't like the crowded halls. They don't like the crowded lunchroom. They don't want to have to give a speech in front of people. A lot of those kids are thriving right now. Their anxiety levels are down and parents are like excited. And I keep saying, you need to go to the therapist. And parents are like, no, we're doing great. We don't need to see the therapist. But I think what's going to happen is when these kids who have been home, now they've been home for 6 months since March, it's going to be longer. And a lot of these families are choosing to do like virtual learning or will be forced to do virtual learning because school isn't going to be open. Those kids do great when they stay home. We are reinforcing what they like to do by allowing them to stay home so much. And that's not going to be helpful when they do have to go back out into the world. So even if anxiety seems like it's doing well, don't forget that anxiety is there. If that's the case in the past, then I'm seeing people that have anxiety for the first time ever. They are very cautious about the germs. They don't want to get sick. They don't want to get a loved one sick. They're afraid of people doing things that aren't within their control, which is true, right? Like especially for these college students I'm hearing from right now, I have never before been asked to write a letter to excuse people from rush activities because rush activities are usually fun. But I have had people who are in the Greek system and they're afraid to go to the Greek activities. People who want to get out of their contracts for housing arrangements because there were too many people in an area. I've never before been asked to write letters of medical necessity for that, but I am seeing that from my college student patients. I have had more requests for emotional support animals this year than ever before from several college students who want to bring their pet to school as an emotional support. I'm not writing those letters because I don't feel that I'm qualified to assess how it's going to help them or in what capacity it can help. So I'm referring them to their therapists, of which many do not have because they haven't before had problems like this. But I can see how it can help. I have college students and I know that they're very isolated right now. Their classes at both of their campuses, 2 different campuses, have all gone virtual. So they're not going to class to see people. One of my students in particular, one of my kids, is living in a single room. So goes and gets food, brings it back up to the dorm room to eat alone. Classes are on Zoom, but basically from a room alone, and not really seeing many people at all, except for maybe if brushing teeth in the community bathroom kind of thing, but they're not really talking. They go back to their rooms. I think so many kids are scared to be with other people, and that is very isolating. And so reach out to any students that you know that are on campuses. Some of them have great support groups and are living with a community of people, whether it's in a dorm or a Greek system setting. But some are very isolated right now. And we have to find ways to kind of balance that risk with all of our lives, because the extreme isolation that we had, like back in March when schools closed and everybody stayed home, people were afraid to go to the store, they were afraid to go anywhere. We can't do that forever. We use isolation to punish prisoners. We cannot enforce it in our families and our students. We need to find ways to socially connect with physical distance. And I have said that since March. And in March, my party line was more socially connect online. I do think there are ways, because we know more how it's spread now. I think there are ways to outdoors stay separate with masks on, but still actually physically be near one another. And I think that's important. Because if we stay too isolated, we're going to develop more anxiety, depression. And I do think these transitions back and forth are going to be hard for our kids. It's hard for parents right now. So many parents are trying to plan the school year. They don't know if they can work or if they're going to have to work from home because their kids are going to be home. If parents have to work outside the home, what are they going to do for their young kids who have to not only be home alone, but now do schoolwork? So do they need to hire a nanny or somebody? But what if school is open and the kids go to school? Then they can't have this nanny. So there are so many people right now who are so anxious because they don't have control over what's going on. And I think we all need to remember that we're upset because the virus is causing issues that are hard to solve. Please don't take it out on the school system, the teachers, the administrators, the boss at work. We are upset, but it's not anyone's fault right now. It is this virus that is really tricky. It is hard to manage, and we're all trying to figure out how to best balance the risks and the benefits of doing various things. Um, so, our personal actions make a big deal or make a big difference. I have had all kinds of people that I've talked to about COVID exposures, and it's at a friend's house, at a sleepover, or at a birthday party, or at grandma's backyard, or a restaurant, anywhere. We can be exposed anywhere. So the best advice I have heard is pretend you're sick and the other people are all sick, but only one of you, because you don't know which one, but one of you is sick. So keep your distance, wash your hands, wear a mask. We need to do that and just presume we all have a risk either of spreading it or catching it at any given time. So then we have to look at the risks and the benefits of our activities. Is it really worth it to go to the bounce house place today because your kids need to burn off some energy? No, you can do something else to burn off energy that is outdoors and physically distanced from other people. Some of the things that I've heard people doing just blow me away. Like, it's not taking any personal responsibility. People are doing things at bars, people are doing things at restaurants, people are doing things in small gathering or small area spaces with too many people. Basically, we have to make better choices so our communities can be safe, so that we can be safe, so that we can get back to doing things, maybe a little adjusted things. But we need to get back to our lives. We need to get back to work. We need to get back to school. Those things might look different. School is not going to be a ton of kids packed into the gym for an assembly. School is going to look different until we get this virus really well under control. But we can't even get to that point where we get to get the kids to school safely if we can't get more personal responsibility in all of the actions that we do. I know sports are a huge thing, so we need to figure out how to adapt the sports so that we can still allow kids to play safely. And some of that's going to depend on the age of the kid and the sport itself, if it's indoors versus outdoors. Some things I can't conceive how they would be done. There are people smarter than me. Maybe they can figure it out. It might be the year, instead of basketball competitions, doing basketball skill drills. So it's more individualized, lose some of the fun. I don't know. Maybe by the time basketball season starts, we will have better containment. But if athletic people or athletes get coronavirus, we know that sometimes it affects long-term fatigue. It can affect the heart muscle. Even people who have very mild disease sometimes are affected more significantly with things down the road. So we have to watch out for the overall safety, not this season necessarily, but the overall safety of our athletes so that they are not suffering long-term consequences from decisions that we make today. So we need to be safe, and it's really hard. I saw a hilarious video of a woman who was pretending to be a newscast person, and she was talking about coronavirus, and she would say things like, and we can't go to stores because stores aren't safe, but unless you have to go to the store to get groceries, because if you need groceries, you got to go to the store. So you should go to the stores, but you can't go to the stores unless you need groceries or toilet paper, but then you can't get toilet paper. It was just like back and forth. And that's kind of how all of our brains, I think, are working right now. But we have to look at the facts, look at what we can do to modify an activity to make it safe, because we can. We just have to think outside the box, and we have to make it work. So basically, that is in a nutshell, kind of how things are going. I think we all just need to work together, and we have to, as a community, think about others more so than ourselves in a lot of ways. But then we have to look at our own unique family needs, our family risks, and take all of that into account, and then make decisions for us that are safe. And talk to our kids, especially middle school kids and up. They're old enough that they want to do things, they challenge the authority, and young people don't see themselves as being significantly at risk from this virus. We all know that kids are invincible, right? Kids are well known to take more risks than adults would do. But with this virus, because their risks not only affect them, it affects the community as a whole. We have to really talk to our kids and our teens and our young adults about making safe choices, smart choices. So I think that's about all I got. I can't see any questions on Facebook because that screen popped out, but let's see if I can open that up to see if there are any other issues. And if there are not any questions, then I will get going. And again, a lot of this was kind of my personal thoughts today, more so than what I usually try to spew with the actual data type stuff, but it did involve a lot of data. So, or what's based on data. So please, if you have any questions, ask real quick. Otherwise, I will cut off and let you guys enjoy your rest of your Friday and your weekend. So thank you, Melinda. Thanks. All right. I think we are about done. Can't get back to that window to turn it off though. All right. Thanks, guys. Bye.